This video will include breathing control techniques and techniques to reduce fear around breathlessness. So firstly, we'll go through the breathing control techniques, starting with breathing control, then to pursed lip breathing, then to positioning, and then using our handheld fan. Our reducing our fear around breathlessness techniques includes box breathing, visualization, 4 Ps, and an action plan. Okay, so the first technique we're going to go through is called breathing control. So you just want to sit comfortably back in your chair, or you can do this in lying down as well. So you're just going to place one hand on top of your chest and one on your stomach, and we're just going to try and control our breathing normally. So we're going to breathe in and out. All the movement of your stomach should be felt in this bottom hand. There should be no movement in the top hand. Try to breathe in for 2 seconds and breathe out for 4. So our breath out is twice as long as our breath in. Okay.
So a second technique that we can use to help with our breathlessness is positioning. So this helps offload the diaphragm muscle, which helps us with breathing. So this muscle often gets overworked when we're short of breath. So by taking a position of ease called tripod position, so we want to just keep our legs shoulder width apart and just lean forward. This can help to offload the diaphragm muscle. So we take a nice few deep breaths here.
Here are some other examples of position of ease. As you can see, position of ease can be in standing, lying down, or sitting. You can also use some pillows to support you in your position of ease. Okay, so our third technique to help with breathlessness is fan therapy. So it's been shown that the sensation of air on our face can help with breathlessness. The sensation of air from the fan stimulates nerves in our face and sends signals up to our brain to dampen breathlessness feelings. So what we're going to do is grab our handheld fan. We're going to turn it on and hold it a couple of inches or 15 to 30 centimetres away from our face. We can move the fan across our face, over and back, all while breathing in and out.
Our next breathing technique is called pursed lips breathing. This can help to alleviate our sense of breathlessness by inhaling for 2 seconds, and then we want to exhale for 4 seconds. But when we exhale, we want to create an O shape with our lips. So we want to create this shape. A cue that we can use to help remember this is that we are smelling roses when we are inhaling, and we are blowing out a candle when we are exhaling. So I will now demonstrate how we do this. So we're going to inhale for 2, and exhale for 4. And then we'll do it together. So inhale for 2, exhale for 4.
Okay, so this is another relaxation technique called visualization. So what we're going to do is sit comfortably in our chair. You can have your eyes open or closed, but we're going to pretend that we're in our favourite place. So somewhere that we're feeling safe and secure. What we're going to do next is think of something that we can see in our favourite place, something we can touch, something that we can smell, something that we can taste, and something that we can hear.
This is a technique that you can use to help you relax when you feel short of breath. This technique is known as box breathing. So what we want to do is we want to picture something that is in the shape of a rectangle, such as like a TV or a photo frame, or for this instance we're going to use this book. So what we want to do is we want to breathe out on the long side of the rectangle and breathe in on the short side. So we want to breathe in for 2 seconds on the short side and breathe out for 4 seconds along the long side. So we'll do this now together. So we're going to breathe in, breathe in, and we just want to keep tracing the rectangle as we breathe. Good.
The 4 Ps of breathlessness management involve planning, pacing, prioritising and positioning. So planning. Plan your day in advance and try and space out all the activities during the week and not concentrate on all activities in one day. Pacing. Focus on one thing at a time. Don't rush. Slow down. Take regular rests and give yourself extra time to get things done. Prioritise. Decide which activities are most of value to you each day. Delegate tasks that are not important and ask for help. Consider spending your time doing things that you enjoy. Positioning. Pay attention to your posture in sitting or standing. Make sure you change your position regularly. Consider using a mobility aid such as a walker with a seat to help save energy and reduce your exertion. The last breathlessness management technique is an action plan. It is important to have an action plan in place for when we do experience breathlessness. Above an example of an action plan that you may use. Try to stop what you're doing and try not to panic and remember your breathlessness will go away. I have had this feeling before, I know it will go away soon. Then we're going to lean forward and use your fan. I'm focusing on my breathing out for longer, gradually longer and longer with each breath out. I am gently relaxing and softening my shoulder a little more each time I breathe out. I can do this. I am doing it now.